You're listening to Finn Voices on Healthcare Now Radio, where we highlight and amplify the voices at the forefront of health innovation, innovation that improves people's lives. Join us for an inside look at the change makers driving conversation and answering the most important questions in healthcare today. Thanks for joining us.
Welcome to another episode of Finn Voices on Healthcare Now Radio. My name's Julian Tyndall-Biscoe. I'm a senior partner in the London office, and today I'm joined by Andrew Reid, who is Chief Executive of the Royal College of Surgeons, England. Andrew has over 30 years' experience in the NHS, having originally trained as an NHS graduate. He has a wealth of experience in the health service, having held 3 chief executive positions, including at Bedford Hospital's NHS Trust and Ipswich Hospital NHS Trust. Andrew, welcome to Healthcare Now Radio.
Thank you, Julian. Thank you for inviting me. Nice to see you.
It's good to see you too. I think one of the things that you and I have spent a lot of time talking about has been the NHS Clinician Manager interface. And there's a lot of discussion about this issue. And I appreciate that we're not going to solve anything in 26 minutes, but it'd be good to get your insight into that interface and how it affects patients and patient outcomes. I'm just wondering whether, in your time as an NHS manager, how were you able to build good relationships with the clinicians at the hospitals you're managing?
Thanks, Julian. I mean, this is, in many respects, a $64,000 question for the NHS. And, I know as you and I have been talking, the NHS operates very differently in this respect to many other health systems around the world, where there is a much less marked divide between managers and clinicians. And it's your first question gets to the nub of the issue, I think, because I don't think there is necessarily a simple and straightforward way of engaging clinicians. But I think trust is really important, and that is much easier said than done, clearly. But I think anything and everything that you can do, and certainly that I did as a manager, a senior manager, and at other levels, to engage clinicians, to make them feel that you were listening to them, that you were responding to what they needed, that you would do what you said, or that you could have, a very, should we call it, robust debate with them. I think all of those things were very important in cementing the relationships, which are so necessary to the success of a hospital.
One of the things that you've mentioned previously is that clinicians stay a long time in a hospital and they become part of the fabric, whereas a manager might be there for 2 or 3 years and then move on. And so clinicians feel as though they don't ever get that longevity of relationship with a hospital trust manager. How can you get beyond that?
Well, again, I think when you take up a new job, and we're particularly here, I suppose, talking about a senior job, particularly chief executive job, you can only state your intention and stick to it. I mean, the picture is changing a little bit now. I think we get fewer consultants who are lifers, so to speak, who will, and again, of course, we're talking clinicians covers a lot of things, but we're talking about senior managers, senior doctors in particular. We are seeing more senior doctors who will work in one hospital in one place and then go to another hospital. But I think the general premise holds true that senior doctors will see themselves as staying longer at a hospital than a chief executive or senior manager. When I took up both of my hospital chief executive jobs, as you mentioned earlier, in Bedford and then in Ipswich, I moved to the area. That's a significant indication of your intent. And then I think you have to win people over in a way. I mean, clearly some people want you to succeed. Some people will warm to you as a person. Others will be more skeptical. here's another one. Give him a couple of years and he'll be gone again. You can only, I think, express your intent, try and, if you like, integrate with the medical community. It helped me living near Ipswich Hospital, that I live in a village where quite a few consultants live. So I would see some of them socially. That can be awkward. Um, but you can also see each other as real people and have that sort of sense that you're here. I had a very young family when I moved there as well. So there are all of those little things, I think, that can just help develop those relationships.
And do you think that more needs to be done? You talked about socializing, meeting the consultants out of the hospital. Do you think that more needs to be done generally in terms of the clinical community and helping them understand the role of the manager? Because the clinicians that I talk to, when we talk about managers, they will say they're only interested in cutting costs. They're very short-termist in that respect. But do they need to have a more clearer understanding on how can we help them?
Yeah, that's absolutely right. And the NHS, as you know, is very tribal. There are tribes within tribes. I mean, there are different groups of clinical staff, nurses, physios, doctors, are tribes within themselves. Within the medical group, there are surgical tribes and medical tribes and radiology tribes and so on. So it's incredibly tribal. And I'm not sure to an extent that we'll ever get over that. But and you rightly say that managers are tarred with this brush of you're only interested in money. Interestingly, when I joined the Royal College of Surgeons of England, which is, as you know, is where I'm now working as chief executive, I was seen by surgeons and staff alike, I think, as an NHS manager who's only interested in money and who only wants to cut things. So it's an image that's difficult to shake off. My conversations with senior doctors in the NHS was particularly around their leadership role. And I've always felt that they have an inescapable leadership role, whether they want to take part in the management process or whether they just want to treat their patients, they have a leadership role. And I would always ask them to understand that, to respect that. I'd want to invite them to participate in the wider management process, whether that's formally through clinical directorships or medical directorships, or whether informally through consultation advisory groups and so on. But I was also clear that if they didn't want to do that, that's fine. But they did have to understand that management decisions needed to be taken, and they would have to live with the decisions that were taken.
Interesting. On the flip side, you're an NHS graduate trainee, management trainee. Do you think there was enough in your training, but also today's training, about the role of clinicians in terms of you're becoming a manager? Is enough time spent with you helping you understand their role?
I think you could always do more of that, and I think it is something of a lifelong issue in many ways. I was a trainee back in the days of black and white almost. It was a long time ago, and actually at that time there was an even bigger divide actually between clinicians and managers. And my formal training program had virtually no clinical content to it whatsoever. But I did spend a lot of time in the laundry department and the domestic department and all of that sort of portering department and all of that sort of stuff. It is a real disability, though, I think, for any manager, particularly any senior manager, but probably any manager at all, at any level, not to understand the clinical world and not to have a basic grasp of clinical terms and clinical processes. You can't do the job without those things. There used to be a program, which I think the NHS sponsored, called Medicine for Managers, which it's almost a sort of series of lectures from clinicians about their world in diabetes or respiratory medicine or cardiac surgery or whatever it was. And I always thought they were tremendously helpful. But I mean that, and I think that in many ways is the source of this still divide that we have between clinicians and managers, that managers probably don't know, or clinicians feel they don't know enough about the clinical world. And of course, managers often feel that clinicians don't know enough about the managerial world.
Yeah. If at either one of those hospitals, Bedford or Ipswich, you'd said, all right, I want to spend a day shadowing consultant or a nurse, even, just to get a better understanding, would you been able to do that, and would that have been a good idea?
Yeah, I did do that in both Bedford and Ipswich, and indeed in other hospitals and clinical services that I worked in. It's really important to do that. I mean, I know that clinicians are very skilled people, and they're experts in their field. And like most experts, it delights them in a way to be able to show their expertise. So I've always had really positive experiences of spending, a day in theatres or a day sitting in an outpatient clinic. I remember at Bedford, actually, not just sitting in a clinic, but actually with the consultant, but also sitting in the waiting room talking to the patients as well. Really fascinating getting that sort of experience. But I think clinicians do undershare that. And of course, they know, and you're not going to walk out of that experience saying, well, now I'm a trained doctor, I know as much as you do. It takes an awful lot of time to get to that point. But I think the willingness to have that familiarity, to understand their world, to try and see the world through their eyes is really important.
You mentioned never being able to have that level of understanding or clinical ability. And we were talking earlier about, actually, in terms of training to become a doctor, there's a lot of years involved. And okay, so a management trainee might have spent some time on the management trainee program, and you're a graduate and you've got your qualifications, but there is that kind of possibly perceived gap between the clinicians, because they've spent this time, they're academics, in academia, whereas an NHS management trainee may not have had that kind of level of academic experience.
Excuse me. Yeah. I think that's right. I do think, though, that there's a level of appreciation of a good manager being a good manager, someone who can get things done, someone who doesn't stand too much on ceremony, doesn't use lots of jargon. And I think language can be quite important. I think those people do win that sort of respect. But you're right, it is endemic in a way in the way that system is built with this sort of managers and clinicians thing, that clinicians have that very long training. To get to medical school, as we know, you have to have fantastic A-level results and tremendously long training. I mean, there is. I mean, I don't want to use this as a generalization, because, as I say, I think very often senior doctors, when they see a good manager, respect them for being a good manager. I have a degree from a good university, and I think that said something, rightly or wrongly, actually, about me as an individual. And in a funny kind of way, I think in some conversations with some individuals, that just gave me a lift up in a way.
Yeah. This is Fin Voices on Healthcare Now Radio. I'm Julian Tyndall-Biscoe, and I'm joined today by Andrew Reid, Chief Executive of the Royal College of Surgeons, England. We've just been talking about the cultural relationship between NHS clinicians and managers, and Andrew's been giving us some insight into his experience. There's one question that comes back to my mind about NHS managers, which is there's a lot of focus and pressure on an NHS hospital manager. And if something does go wrong, if there's a patient safety incident, although clinicians are at the heart of that patient treatment, it is the manager who has to stand outside the hospital and have the cameras pointed in their face and respond. Now, there's two sides of that. There's that level of pressure that puts you under as a manager, but then some clinicians sometimes feel, well, although these experiences are very real, they're not quite as real as being involved in an incident with a patient where the patient may die at your own hands. So there's two things there. There's, yes, I've got to face the media, but do I really get that in-depth feeling that a clinician might feel?
Yeah, and I don't think if you're not a clinician and you're not involved in that particular case, you can probably never replicate that. And it's something that, for me, brings out great respect and admiration for clinicians and the job they do, that inevitably something will go wrong, however good a clinician they are. And, working with surgeons as I do now, I have been very impressed is probably not quite the right word, but I've been very struck by, surgeons. I remember one surgeon saying to me, whenever I go into the operating theatre, I have the ghosts of my failed cases sitting on my shoulder. And he was saying that, not to say he had anything to fear about doing an operation, but just to say he was aware of the fact that he's not perfect. He's not, he's human, and he's got to be absolutely on his mettle to undertake the operation. You can't replicate that as a non-clinician, but you can understand it. And I think you can support clinicians when they go through that sort of thing. One of the things we're doing at the Royal College of Surgeons is we're supporting a program whereby when a surgeon makes a mistake at any level of their training, another surgeon will ring them up and say, "Are you okay? Can I support you?" I think that's incredibly important. So, I mean, you're right. There is that, the manager, particularly for a big, serious clinical incident, will be the front person. And, managers do feel that sort of thing as well. It is a matter of pride to be running a hospital is regarded as clinically excellent and safe. So, it's not right, as people sometimes feel, that managers aren't touched by that sort of thing. We are touched by that kind of thing, but I think we have to support clinicians and to help them through what can be a very difficult process when something's gone terribly wrong.
Yeah. You talked about the challenge for managers. Does the NHS do enough to support managers when it comes to having to be the voice of the hospital and to take that pressure? And in terms of, I suppose, emotional resilience, do we give enough support to our NHS hospital managers?
Well, I think part of the answer to that question is about support from the NHS, and it can be a pretty unforgiving place. I don't know what the stats are these days, but certainly it's not very long since the average, can I call it life expectancy of a chief executive, i.e. the time in the job was about 2 years. I mean, there's really only Premiership football managers that have a lower expectancy than that. And of course, that feeds this whole thing about, well, here comes another chief exec, and they don't have the same investment in this hospital that I do as a clinician, and if I just keep my head down, they'll be gone again in a couple of years. So that needs to be recognised. I think there's certainly more messaging about recognising that and supporting people from the NHS at the moment, from NHS England, and understanding that that's not ultimately a good thing, that actually there needs to be more support for managers. But the other side of that, I think, is about the managers themselves, about us as senior managers. We need to be much less hard on ourselves, much more disciplined about taking breaks and so on. If my wife were here, Julian, as you know, she would say that I was very bad at doing that when I was a chief executive. And I know lots and lots of colleagues who worked every hour under the sun. It's a really, really difficult thing to do. But ultimately, I think there is something, and perhaps one has to listen to one's family in particular, your partner and so on. Ultimately, I think we do have to take the breaks when we need them and look after ourselves. And I don't think we should. I mean, we should expect an institution not to criticise us for doing that.
Yes.
But I don't think we should expect the NHS to say, now you must do that.
No. And I suppose that goes down because you're at the top of the tree in terms of the management. You have people who report to you who are managers in their own right, and they will have they will face their own pressures, daily pressures. And I suppose it goes for every manager in the NHS that at some point you have to say, I need to take some time for myself. But as you say, is the NHS supporting that? I don't,
Yeah, and I think, the other part of that, of course, is you've got to look after your team. And I think that's one of the really critical elements of, a successful leader, successful manager, is that, you select the right team and you look after them. And I'm not saying I was any better. I'm certainly not perfect in that respect, but you have to look for the warning signs in your team as well.
Yeah, and I suppose if you're nurturing talent, then I guess you will want to nurture the talent, those individuals who are able to have a balance in their lives, and allow them to be able to say to you, listen, I'm not feeling this isn't working for me at the moment. I need to take a break. So that part of that nurturing process, I guess, must involve you yourself saying, I accept that this is too much for you.
Yeah, and it's I'm sort of very conscious that it's easy to talk about this subject in the abstract, and it's quite difficult to do when you're there at the time. The NHS has got a long hours culture. It's still got a long hours culture. It's a 24/7 organisation. That means for managers and clinicians, you're constantly thinking about what's going on, what needs to be done. So it is tremendously difficult to address that. The European Working Time Directive, as was, so to speak, was sort of interesting in terms of how it landed, particularly with doctors. You get some who will say it was terrible. And, when I was a junior, I used to work, all hours under the sun, and what's wrong with that? And you get others who would say, you need a break, and you're going to make mistakes if you're too tired. I think the dial is turning a bit more towards the sensible hours and balance of work. And long may that continue.
Yes. I've noticed the time, and I wanted to say that we're probably going to have to bring this to a close, but we've touched on a lot of subjects here, and I think it possibly worth coming back to them at some point. It's been very enlightening listening to you talking about your role and how we can help to bridge that divide or the gap between managers and clinicians. So thank you for your time.
Pleasure. Thank you, Julian.
And don't forget to tune in next time to Fin Voices on Healthcare Now Radio, and see you next time.
Fin Voices is brought to you by Fin Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact on the world around us. Learn more at finpartners.com and follow us on Twitter @FinPartners.